started, but before we start, I'd like to stand for a moment of silence in the passing of Legislator Kuhn, who passed away last week. Thank you. First is the, are there any corrections to the minutes? Seeing none, the minutes are approved. No local laws. Item 1, Scott, would you like to come up? So this is a personnel resolution from the probation department.
Good morning, everyone.
Good morning.
Scott Snyder from the probation department. Do you have?
Yes. Yep, everybody.
Yep.
Anybody want a copy?
So this is the resolution for adding a senior probation officer position to our department. This was presented to you by probation director Jackson previously, but it didn't go through enough time for it to be included in your last committee meeting.
This is part of that grant.
Part of the juvenile justice grant that we received from the
Yeah, it's
city.
a position we talked about in committee last time relative to the grant funds, right?
Yes, correct.
Yeah, the budget is 115, and then the position is a grade 12.
Yeah.
So,
I'll move it.
Second.
when do you want to have this person, or when would you like to have this person hired and on board?
Would we like or?
Reality, what is the best? You know?
Probably a couple months. I mean, we have to offer it and go through that. But I mean, we're ready to move as soon as possible.
Okay.
Is there anybody internally who'd be eligible for this promotion-wise, or is it?
Yes.
Good, I'm glad to see that.
Yes, we expect it to be internal.
Excellent.
And the funding is going to be reoccurring, or will it come out?
We do not know, but if I mean, this was when it was given to us, it was presented. We don't know, but if it were not to be given to us again, then we would just include this in our next raise the age plan. It's 100% fully funded.
Yeah, director talked about that the last meeting, where they would just put it into a different category and then the funding would come through. Okay. Any other questions? All in favor?
Aye.
Opposed? Good. Thank you so much.
Great, thank you. Have a good day, everybody.
Thank
Next is an
you.
informational update on nurse navigation and mental health services. Thank you, Commissioner.
Yeah. Good morning.
Good morning.
I think everyone's met our newest deputy, Dana Smith, but if you haven't, and Esteban Gonzalez is with us as well. So we're going to talk about those two things. We want to also talk about hiring and some AI initiatives as well, because those are things I think you'll be interested in. So for the mental health side of things, things are moving very well. We continue to have regular meetings monthly with many partners across the county, all of our mental health partners, variety of people across county representation in city and Syracuse Police. And we have succeeded in moving towards having what we're calling a PIC coordinator position that is going to sit at 911. So what that will be is kind of a pseudo dispatch position for a person from contact to sit with us and coordinate all these different mobile crisis teams that are out there and be able to dispatch them. Right now we're doing that with a 911 person, and it's working okay, but that is really the right way to do it because there's just so many resources. The funding would also allow us to have a crisis counselor there 24/7. Right now that counselor is only there a third of the day, about 8 hours a day. So when we talk about the culture change that we're trying to move towards, to have this true diversion away from police resources, we need to have it 24/7. So thank you for the resources that we're getting from the county. So half of it is from the county, half of it's from the city. I actually go to Syracuse Common Council tomorrow to help with that. But things are looking like they're moving in that right direction to be able to get this funding.
Did that funding get cut through those cuts that they made of the $16 million that the state or the city made to the mayor's budget? Do you know?
It's coming out of grant funding.
Okay.
It's going to be opioid funding. So that's my knowledge.
Just making sure that.
Yeah, no,
it's
thank
not
you. No,
part of
no,
that.
I have not been told that. So I think it's still looking good and secure. So we're continuing to follow the numbers and see how beneficial this is. I mean, realistically, as people continue to use 988 appropriately, those numbers will change over time, right? I mean, but in our county, we still get, almost 500 calls a month that are related to mental health calls. I mean, that's a lot. So we need
So this
to-
has the potential as it becomes more widely known to be a second position potentially.
Say that again.
Does the potential exist to add additional positions later on? Or
I don't
the
think
need
so.
for it, or no?
No, I think this is it. I think this is what we need. I think we'll be able to see the true benefit from it. Yeah. But what we are really moving towards is like what we're calling the fourth lever. I mean, we are really revolutionizing the ability to integrate mental health dispatch into our CAD system. And
I think it's great the less time we have law enforcement addressing some of the issues that they don't have this skill set or the training to handle. The more we can divert this, the better off the community is going to be, law enforcement's going to be.
exactly.
It's a win-win for everybody.
Thank you.
And 911's going to be, because they're not getting the same calls over and over again, because the responding police officer, by no fault of their own, didn't have the skill set to properly address what needed to be addressed, or didn't have the knowledge of the resources available.
Exactly. You hit the nail on the head. That's exactly why we're doing this. They don't want to go around those calls anymore. This is exactly what this is for. It's a win-win for everyone, and it reduces the risk.
It's one of the better things I've seen come out of there in a long time. I mean,
Thank
this is I can't say how much from being on the other side of it,
Yeah.
and I think this is going to benefit the public and law enforcement.
Thank you. Thank you.
Kudos.
You want to add anything from the
No,
CAD
just-
side?
Our staff are actually making mental health a separate discipline, so instead of just police, fire, and EMS, we'll have mental health. And that'll streamline the process, make it easier to track information, but it's truly benefits the patient, the public, and there's a process that if we have repeat callers working with mental health and social services, we can get those individuals the help they need instead of calling 911 100 times a month.
Yeah.
Or more.
You should be screaming this from the mountaintops.
Yeah.
Because I think this is one of the better things we've seen come in a long time.
Thank you. Once we secure that funding, from the city, we look forward to putting that out into the public and letting everyone know.
How do we, I have an agency in my district that has, we call it the frequent flyer.
Yeah.
I mean, it's every day. How do we put that chief or that EMS agency in touch, and who do we put them in touch with at 911 to maybe see if there's some coordination? Because that's just taking an ambulance out of service
Right.
to deal with something that might not, that many times, it's 7-8 times a month.
A month. So is there a person in crisis or mental health component to this?
I think so, yeah.
Okay. I mean, if there is.
At this point it is, yeah.
Yeah, so the group that's also a big part of this is Amy Cunningham's and Jen Parmalee's groups. And Jen Parmalee's like the mental health coordinator. Some of those long-term type issues we're trying to move towards their department, to have people going out and working with them on a regular basis. So those would be the right people to talk to.
And they work up there.
They're Amy Cunningham's the head of adult and long-term care.
Okay.
And Jen works for her, but they've been the two reps from that side of things. And the funding for this really comes out of their budget, actually,
Okay.
not mine.
Yeah, because that's what we used to do, just call for an ambulance and let you guys take it.
That's what I was gonna ask, if it's reached that stage where mental health, personnel will be with, the officers, responders,
Yes.
anything like that,
Yes.
without jeopardizing their safety.
Yeah, we look at that constantly. Yeah, so you want to talk
And
about
that's
that?
part of the process now. There's a bunch of different resources. One of them, as CIT trained Syracuse police officer in conjunction with a mental health officer, and professional, ride together on calls and go on calls. That's grant funded. I think it ends at the end of August, but the numbers and the effectiveness were pretty positive. So hopefully the city can get funding.
It would be a great partnership to be able to see the staffing numbers go high enough where you could have a specifically trained police officer who handles this, maybe one or two throughout the whole city, respond with a person in crisis counselor. But that might be the next step of this.
Yeah.
That's a great thought.
That's what I was gonna ask also about, training, officers, sheriff's deputies, I don't know how long mental health training is. But
Well,
of course,
I believe CIT, the crisis intervention training, has become part of the state educational program.
Yeah,
for
so
police
it's academy, when I went to the police academy, many, many years ago, it was a 2-hour block.
geez, that's
That was it. However, it's much more in-depth, it's multi-day now, and it's part of the regular in-service training.
Yeah,
It's
and-
done annually through DCJS.
And it's the CIT training specifically is a 40-hour course as part of the academy.
That's great.
I was involved in it in previous employment.
I just want to make sure we all know, so this is also moving, not just from the city to the county as well. So
Yeah.
we'll be working with all the police agencies, you know, and everybody kind of has different levels of resources, different priorities. So, yeah, the ability to go and co-respond will vary, depending if we're working with a town and village versus the city. Yeah. Any other questions on that?
Great job.
Okay, great, thank you. So nurse navigation is something that we've been talking about for a while. We wanted to share this sheet with you, just to kind of give you an idea of where we're going with the program. So you'll see at the bottom there, the kind of the phase one foundational part of the process. That's where we've been for the last few years. And in talking with nurse navigation and the customer bases that they have, that's normal for us to be kind of in that range at starting out, but that's not good enough. You know, we want to be moving much, pushing the envelope and having a higher percentage of EMS calls being diverted. So our goal is to get up to 10% by next year. And you want to talk about, Dana, the
Sure.
ways we're going to be doing that?
Sure. So one of the first things that we're doing is re-educating the staff. The adult learner needs to understand the why. How is this important to me, and how is it positively impact me? We've worked with nurse navigation to update the training program from a call taker's perspective. The original documentation they sent out several years ago was about from the nurse's view. So one of their staff used to work in 911, and we've been working on it and just got it yesterday, the training program for our staff. Additionally, we're adding the incident types that we're increasing the number of calls that are eligible to go to nurse navigation. And I don't have them with me, but the statistics of why people are calling 911 in the city, over 50% of the people for a non-life-threatening illness are calling because they don't have a ride, you know, and they're going to the ER, which impacts the hospitals negatively, increased costs, increased waiting time. So steering more and more of those patients to nurse navigation, which does have a telemedicine component to it, will absolutely positively improve the outcomes for the community. And that's what we plan on doing, training our staff over the summer, updating the protocols and which calls we can allow to go to, and then keep a close eye and just really reinforce its use.
Have you narrowed down on, like, I used, I'm just so used to Fayetteville, we had East Side Manor, we had Clare Ridge, we had all these high use of the medical center, we had these high, they were 50% of our calls, and about 50% of the 50% could have used, and I know from an example, I have a family member who, they just called, and they took her in, I got there, and the hospital said, this is ridiculous, like, this is, and so I went back and said something, and they said, well, we're tasked with having to send them to the hospital. Wait a minute, that just wasted resources, time, blah, blah, blah. So I didn't know if you were looking at nursing homes or high, facilities that had, patients like that use it a lot.
So they primarily wouldn't fit into nurse navigation because there's already a pre-existing medical professional relationship, an RN or physician directed or nurse practitioner directed program. But in situations like that, we can work with the EMS coordinator and their medical director to educate the staff on the most appropriate use of EMS. And that's a challenge. I spent 21 years in EMS previous in my first career, and I understand the challenges associated with that. But if you do know of facilities like that or something, that absolutely we'll know. We'll work closely with the EMS coordinator to resolve that.
Yeah, and that was my next question. We work with Jeff Van Beveren to see how this works with the EMS study.
Yeah,
Great.
Jeff is on the team that's putting this together.
Okay, good, great.
I mean, we have a few major ones in the area.
Oh, yeah.
We coordinate whether to work with them, maybe they become our test model. I guess it's gotta be a burden on them too.
For sure.
Yeah.
For sure, yep. And so like the ambulance directors, if they get briefed on these things.
And we have somebody that sits on that committee as well.
Oh, good.
Yeah.
And I went to one so far.
Any other questions? These are two programs that are just, nurse navigation's what, a year and a half, 2 years old?
Yeah, at least.
And
No,
the
I think
mental
even 3
is-
now. Yeah, maybe 3. Yeah, mental health has been probably close to the same.
So I thought it's important to get an update.
No, it's great.
So, any questions?
I have a comment though. I just want to recognize what a wonderful program you had recognizing the staff.
Oh, thank
The
you so
other
much.
day.
Thank you for coming too.
It was just exciting to see everybody there, happy, excited, being recognized for their service. It was very nicely done.
Thank you so much. That means a lot. It really does. A lot of people put a lot of effort into that.
Yeah.
And thank you. It's important to us and to the staff to see the partners and the legislators there. So thank you.
The only comment, I think the county needs to give you a larger conference room.
We appreciate that.
That was standing room only.
It
We
was-
have the old South Station.
Here's your
That might
helmet,
be
go
an
inside.
Exactly, watch the bricks.
Yeah. Maybe capital improvement time we'll be back talking about stuff like that.
You want to update us on AI?
Yes, in hiring. So we've been here talking about hiring and getting our staffing numbers up. So we are at a point now, there's a class in the fall of 8 that will get us to filling every funded position. So I just want to share that with you. So we are getting closer. I know overtime is something we're always watching. And I also just want to just have a point on that because we're doing so much training. You got to remember that that's 2 people every time there's somebody being trained and there's a person sitting next to them. So that doubles the amount of people that were on the floor, and that's a big reason why our overtime numbers continue to look very high. So we're watching that, and we're trying to just do the best we can. But until we kind of keep getting out of this situation that we're in with getting our staffing numbers up, that overtime number is still higher than normal, and it is part of doing business.
It is part of doing business.
It's just when you're a 24/7 operation. So AI, moving to that, this is a very exciting time for us. It's an initiative from the county executive level, and it's something we've been watching for several years. When Dana came on board, that was one of the first things we asked him to do was to look at a couple different companies, and we have now settled on one called Prepared. They are out of New York City. They're a small company that focuses strictly on AI, a young company, but they are in 49 states now. They're growing, they're up to 100 people, and their technology is quite remarkable compared to things like, we're gonna talk about transcription here in a second, but in comparison to Amazon transcription or some of these diffigger companies, they are setting themselves apart, and they're starting to get a little bit more attention. So it's just a really impressive company. They're very customer driven, so we've developed a relationship with them, and some of my partners have as well, that we're just really impressed with the way they really are approaching the problem and care about 911 centers and the staff. So their heads are in the right place. So there's 3 things that we're going to be getting from them. One is a transcription service. So when the calls come in, the calls will be transcribed from the call taker side and the caller side. It'll transcribe the whole thing. It will summarize it. It will also translate it. So we're paying for translation services that we will no longer have to pay for. It will do all that for us. It does not, it does not replace the job of a call taker in any way. It enhances their ability to do their job, right? It makes it easier. They don't have to go back and listen, when they're looking for data points that they might have missed. They can go right through the report there, but it will make their job a lot easier. So it's very exciting. That is one thing. The next thing is probably the one I'm most excited about is a QA/QI tool. So we will now have the ability to do what one of our staff members does. They do quality control on staff on a regular basis, but the staff don't see those reports until weeks or months later, and that's not very effective in changing the outcome of an event, obviously, in real time. So now we're going to have the ability to do it much closer to real time. Somebody will be going through their call, and there will be more or less check marks that we will set. We get to preset things that are important to our county and things into our own protocols of, did you ask this, did you ask this, in a nurse navigation situation. This is a call that should be diverted. Sometimes they're not being diverted because we're still working on that culture change. Now it's going to say, hey, this needs to get diverted. Same with mental health. So it's gonna alleviate a lot of stress on the supervisors because we put a lot of pressure on them to kind of be looking for things, and they can't possibly be doing that with all the calls that come in. So it's a really impressive tool. It will help make everything more consistent and more consistent in real time. So that's really exciting. And then the last one Centers are using this across, some of the bigger centers are using this one across the country. And it's one I've been watching for a while, so I'm very excited. It's another, it's kind of a call diversion system. So it's a non-emergency triage system. So you'd be surprised we take, how many non-emergency calls we take that are not related to EMS or mental health or things like, something related to more like a 211 issue. They need an information type phone call, right? And then we take that call and we transfer it to another person in our staff for an information line. So now that would get transferred to this service it's a computer. I mean, it's gonna automatically have a conversation with the person, and it's very impressive. I mean, I've heard it. It sounds like a real person. I mean, you're asking questions and it's responding to you like a real person. So it's going to alleviate that more effective, and it's going to allow us to have that person who's doing the info line be back, taking real emergency calls. So very exciting. And it will help our what we call our 90 times, the number of calls that come in and how fast we answer them. It'll improve our numbers in that space because we won't be focusing so much time on these information lines. We'll be able to move them a lot faster. So very exciting.
So for an example, like the thing I sent you, that may take that time from whatever it was down to half that or whatever that number.
Yeah, for sure.
Just by taking those calls out of the.
Takes it out of the queue.
Got it.
Yeah.
It will close the call. It can follow up with the caller, send a text message to them with all the information. There's over 200,000 non-emergency calls a year
It's crazy.
into the center. So where's my car was impounded, where is it? Things like that we get, when is court?
There's a tree in the road, who do I call? There's a dead deer on the side of the road,
Yeah.
all this nonsense.
Yeah, and it is impressive, and when we demoed it, it sounds like you're talking to a real person.
Really
It's
neat.
pretty impressive.
Yeah. So,
How does it
Mark's
reply
actually
or
real.
respond when somebody's irate, because every now and then those calls come in, why are you asking me these questions? I need help, yeah.
it can transfer back. It will transfer back to a human. At some point, it will say, yeah, this is time to go back.
And the
Let me
first,
get you somebody else.
the first component the commissioner spoke about, the call taker assist, that because the center's so busy and there's so many calls going on, the supervisors aren't aware of every call the call taker's taking. This system is designed based on incident type to give them an alert, like infant CPR
Thank you.
or multiple people shot. Or if the call taker or the caller start to escalate in tone or frequency, it'll notify the supervisor to say, pay attention to this call.
Yeah.
Wow.
And to provide really good support and customer service right then and there. And one of the reasons we chose this organization is their responsiveness. We were in a meeting with our rep, and then we did a demo 2 weeks later, and the commissioner made a suggestion. That suggestion was live 2 weeks later. So they're very responsive to supporting us and cover some of the largest 911 centers in the country.
It's gonna be interesting to watch that roll out.
Yeah.
Is AI funding as part of that package that we passed? The county executive's $1 million, or was part of your initiative that's in your?
We have grant funding we're going to cover with this
Okay.
year. We have talked to Kevin Sexton. I think we're okay at the moment, but
Okay.
I've asked Kevin Sexton
Okay.
if we could look
any
at everything to
cost
make sure
figures
that
for
we are
this?
being included in the bigger package. So we can
I
figure out
don't know
how we're
next
gonna
year.
fund it.
This year, we've committed about just inside of $90,000 towards it this year,
Yep.
and of grant funding. And I don't recall, I don't have it next year's amount.
I think it's close to 250 to 300, yeah.
Sounds
So we're working on
expensive.
that, yeah. It's
Sounds like it's needed.
it is. gonna-
Yeah, what do you put for a dollar on this? For
4,000
what it
calls
can
a
do?
week that are non-emergency calls, and this is gonna help deal with that. I mean, it's gotta be a program that is an initiative that we should be looking at. Absolutely.
And I think it'll have a real positive impact on the staff as well and their well-being
Yeah.
to get those calls out, because they're seeing 911 calls stacking up and they're not being able to get to them and not.
And they're stuck on, I don't wanna say stupid calls, but not true emergency calls.
Yeah, not a life-threatening
Right.
emergency, and they can move it off to the system rapidly. And
Alleviate their stress. I mean, there's so much more that we're learning about their stress level. Anything we can do to alleviate that and make their job easier is a win.
It's funny you said it's not replacing call takers. Were they worried about that? Right? You started by, I bet someone would be like, oh, they're not even gonna need us here.
Yeah, no, but that, we still need people first, yeah.
I mean, if this goes too far, they're gonna pilot program this in the 11th district, and Tim's gonna get rid of me, so I'm a little worried.
When I sat that day with Rick,
Yeah.
he mentioned that there's a lot of that, so I think they are hitting it right on the head. Because he was saying
it's
this
great
just takes
stuff.
away from everything else, yeah, it's gotta wear on them.
Yeah.
Knowing that that's not what their intent is.
Yes.
Any other questions?
Just a flashback, the positions you're trying to fill, are they the non-civil service positions?
No, they're all civil service positions, the ones I was just talking about before.
Exam.
Yeah, so, well, with the help program, we are filling them with the help program.
Right.
So they're still civil service
Right.
positions technically, but we don't have to use the civil service requirements to hire them, if that makes sense. Yeah,
So
the exam, right, it
they're
eliminates,
exempt.
it eliminates the
Right.
exam,
Right.
for right now, yes.
And then once they complete a full year, they get full civil service rank and privilege moving forward. And it was all designed to allow it to make it easy for certain job titles to be hired across the state.
Because I think it's been helpful in a lot of departments.
Oh, for sure. Oh, my
Just
gosh.
because you're not a good test taker doesn't mean you won't be a good call taker. You know what I mean? That's the promise.
Well,
And the constant recruitment, I mean,
Right.
we have
Right.
a recruitment team, we are putting a lot of effort into doing that on a regular basis, so to bring people in regularly for interviews is a much better way of doing business for us than waiting for a test once a year. And a lot of those people move on too, I mean, they can't wait, and people are ready to.
It
Good
takes
job.
9 to 10 months to get a certified list from an exam they took in January. For a job they applied for the previous November. So that in itself, the state process just makes it so challenging.
It's even more compounded with fire, EMS, and police. They're all struggling right now.
Yeah.
With recruiting and corrections, with recruiting classes. So it's a problem.
Yeah.
Okay, any other questions?
Oh, great stuff.
Thank you so
Thank you.
much.
Have a good day.
Yeah, thank you.
That is our agenda. Thank you very much.
Thank you, sir.
That's right.
I got it. I caught it. Thank you for giving me that.
You know, it is not